This week, the FDA will consider emergency approval for Pfizer's coronavirus vaccine. Here in Kentucky, the first doses are expected to be given to frontline healthcare workers and long-term care facilities. But 12,000 doses in that first shipment will be delivered to only 11 Kentucky hospitals. That leaves some healthcare workers left out of that initial group. Olivia Russell talked to one doctor who's frustrated by that plan. That story's first on Fox.
The COVID-19 vaccine seemed like a light at the end of the tunnel for healthcare workers, but some say that light just got dimmer.
They're feeling like there's no hope in sight right now.
Dr. Nichelle Jadov works at one of the many Kentucky hospitals that isn't part of the initial distribution for the Pfizer vaccine.
Some of the other physicians, people were very disappointed to not be included to get the vaccine.
The state's first shipment will include more than 38,000 doses. About 26,000 will go to residents and staff in long-term care facilities, and the remaining 12,000 will be distributed to healthcare workers in 11 hospitals.
There's a much smaller allocation that's going to be going to hospitals and absolutely none going to EMS workers and firefighters and folks like that that are constantly in contact with people that they don't even know if they have coronavirus or not until they've brought them into the hospital.
Dr. Jadov's other concern is how those 11 hospitals were selected.
I'm not personally familiar with all of the hospitals on the list, but there were a couple of facilities that definitely on a daily basis refer their most critical patients to larger facilities. The one that I work at.
While she's confused about this first round, she's hopeful the state will consider those other healthcare workers in the next shipment.
People definitely are ready to get the vaccine and have some hope.
In Lexington, Olivia Russell for the Fox 56 10 o'clock news.
Governor Beshear says the state expects to receive roughly 76,000 Moderna vaccine doses later this month.